to talk to you about PRP. PRP stands for platelet-rich plasma. I've been doing PRP for over 10 years now, and I've used various types of systems in order to get the best quality platelet possible. Initially, when I started off, I used a system which was a centrifuge, that you would take a small volume of blood out, probably about 20 cc's, and you put it in these tubes and you centrifuge and spin it down, and then you would separate the top portion of the plasma and use that as PRP. Well, over the years I've used another system, and then finally this is the system that I use. I use this system because I've found that actually a lot of hospitals use the system, and I'm having it here in my office, which is a system that you actually take out not just 20 cc's of blood, but you take out 180 milliliters. That means you take 3 of these syringes full of blood, and then you place it into the bag here, which is called whole blood. And you have this setup where there's a big centrifuge that you put it into this machine, and you have a light system right here. So the light system actually is able to differentiate between red blood cells, white cells, and platelets because of the different frequency of light it reflects and absorbs. So you put the blood in the machine and you turn it on, and the machine does all the work for you. It actually spins it down and separates it into what they call red cell, RBC out. So you have whole blood, it takes out pure red blood cells. Then it takes out PPP, which is platelet poor plasma. You don't want that. That's the stuff that's yellow, that really doesn't have a high concentration of platelets. And then in this syringe, which is attached to this right here, you get a small quantity of PRP, platelet-rich plasma. Now, out of 180 milliliters of blood, you may only get about 5 or 6 milliliters, this much volume of pure, rich platelets. That's what you want. This is the good stuff. I call it liquid gold. So now, this is another very important factor. Now that you have your PRP, platelet-rich plasma, what do you do with it? Well, without a doubt, all my procedures are performed using guidance. What does that mean? I use an ultrasound for injecting into tendons, and some people use it to inject into joints, but I prefer to use a fluoroscopy or x-ray at very low dose concentration of radiation x-ray beam, very low dose, to find the joint space to put the platelet-rich plasma into the exact location. So I will show you in a few minutes what an ultrasound guidance injection looks like, and also how you perform an injection into a joint using fluoroscopic guidance. So basically, I use one of the best systems that I believe that's out there, that's used in a lot of hospitals, here in my office, and I get a very high, good quality concentration of platelets to give you the best results. Now, why do you want pure platelets? That's basically how your body heals. If you get a cut, it takes 4 to 6 weeks before you can heal. So we're taking a very good concentration of that platelet that runs through your bloodstream and attaches to the little cut, and it heals it over time. So we're taking a very good concentration of this pure platelet and injecting it specifically in a very painful area. For example, if you have tendonitis or if you have a joint problem, and you're injecting its platelet using precise guidance using an ultrasound or x-ray, which I call a guided missile. So that medicine is going directly into that inflamed area without guessing. And I tend to use the terminology, you don't want a blind injection, meaning that you don't want a physician to inject a very expensive substance into an area that you want to heal without knowing exactly and precisely where it's going. So that's why I would recommend always guidance using either ultrasound or fluoroscopy.